Good afternoon, and welcome to the Financial Empowerment Virtual Learning Series. Our training today is about COVID-19 health insurance options. The Financial Empowerment Network envisions communities where low and moderate income individuals and families can achieve financial well-being. Our mission is to advance financial empowerment through partnerships that support access to affordable, effective, and relevant services, products, and other resources. Our process is to serve as a liaison and broker to create connections, disseminate evidence-based and promising practices, and bring resources to a network of providers to integrate financial empowerment into other services, including anti-poverty strategies. I'm thrilled to have today with us Daphne Pye. Daphne is the Health Services Administrator 2 for Public Health Seattle and King County. She's with the Community Health Services Access and Outreach Program. Daphne's worked for King County for over 25 years, and her work has always included finding ways to reduce barriers in accessing public benefits, eliminating health disparities, and ensuring that residents could access quality health care services. Under her direction, she also manages King County Navigator Program, ORCA Lift, access to Baby and Childhood Dentistry, Breast Cervical Colon Outreach Program, Community Health Access Program, Phone Line, also known as CHAP, and the Basic Food Program for Public Health. I've had the honor of knowing and working with Daphne for almost 9 years. And when I first met her, I have to tell you that I thought, this is a woman that I need to stay connected with. And so I'm absolutely thrilled to introduce Daphne Pye today. Daphne, I'm going to turn the screen over to you, and thank you so much for being here with us.
Thank you for having me. It's been a pleasure working with Alice these last few years, and I'm really honored that I'm here today to be able to help you all understand the health insurance options that we have in Washington State. And so let's get started. What we're going to talk about this afternoon is we're going to talk about what the health insurance options are in Washington State. We'll also briefly talk about some additional programs that clients could be eligible for. And then lastly, we'll talk about how can someone get help, individual help to get enrolled. Now, just to give you a little understanding about what we do, my program does. As Alice says, I'm with Public Health. I manage the Access and Outreach Program. And what we do is that we ensure that residents within King County can access various public benefits. That includes anything from health insurance to classic Medicaid, energy assistance, the ORCA Lift program. Our job is to reduce the barriers. We also maintain 30 different outreach locations when it's not the time that we have now. Under COVID-19, we don't have any outreach locations right now. But in the normal time, we'd have 30 different outreach locations throughout King County. And we have 2 walk-in storefronts, one in downtown Seattle and one in Federal Way. But with the governor's stay-at-home order, we are also staying at home, and we're doing all of our work and enrollments on the phone. There are no co-pays, no insurance, no deductible. Eligibility is going to be based on several different factors, and we'll talk about that a little bit more. In our state, we have Apple Health for adults, Apple Health for children, we have Apple Health Pregnancy Medical, Apple Health Alien Emergency Medical, and Apple Health Age, Blind, and Disabled. Now, in most cases, when someone is over income to buy an Apple Health program, they can enroll in, and that's in our second category, they can enroll into a qualified health plan, or QHP. These are private plans. All these plans are certified by the State Insurance Commissioner. These plans offer great coverage. When we'll talk a little bit more about what coverage they actually will give you. And also, there is no pre-existing condition. So when someone enrolls in Apple Health, if someone has diabetes, that's fine. If someone has to enroll into a qualified health plan and they have a pre-existing condition like a diabetes, that's fine also. And in most cases, clients can get help paying their monthly premiums. Under a qualified health plan, there's a premium. It's not free. There's co-pays, there's co-insurance, there's a deductible. But in most cases, we can help clients apply for or automatically get a tax credit. And we'll be able to see what the tax credit, more about the tax credit shortly. Also in our state, we have a program that's called Classic Medicaid. Now for Apple Health and qualified health plans, you apply through Health Plan Finder. For Classic Medicaid, that is a Department of Social and Health Services program. And you may have heard it, people say ABOD, or you may hear people say it as the AGE program, but it's the Age, Blind, and Disabled program. It's for individuals who are either over 65 age, they're legally blind, or they have a physical and mental disability. And that program's eligibility is determined through the Department of Social and Health Services. And you apply for those programs through Washington Connection. In any of our programs that we're going to talk about today, the one thing that you have to understand is that citizenship and lawfully presence is always going to be a factor in all programs. Your citizenship, a client's citizenship and lawful presence is going to determine if they can enroll in coverage, and it's going to determine which program they could potentially be eligible for. This chart kind of gives you a breakdown of what we're saying here when we look at our medical programs to determine what can someone be eligible for, who's eligible to enroll. So for example, if someone is US or they're a national, they're eligible for all of our programs. So that's going to be a qualified health plan with tax credit. That's going to be all of our Apple Health programs. If someone's a citizen or a national, they're going to be eligible. If someone is an asylee, a refugee, a victim of violence, they're also going to be eligible for all of those programs. So that's kind of the easy part of eligibility, is that you know if you're either of these categories, you're going to be eligible. Where the challenge comes in at is when someone isn't in one of those categories. So for example, lawfully present resident. Now if someone's lawfully present and they've been here over 5 years, they're going to be eligible to get a qualified health plan with tax credit. They're going to be eligible for Apple Health. They're going to be eligible for pregnancy medical. That's fine. They're going to be eligible for those programs. However, when someone is lawfully present, so they have a green card and they've been here less than 5 years, what you'll see based on this chart is they can still buy a qualified health plan, but they're not eligible to buy Apple Health. So that is a big difference. A lot of times when we're talking to folks who are not US citizens and they're here on a green card, here legally, they're always challenged to understand why they're not eligible to get Apple Health, although they're income eligible. That's because someone that's here and they're here legally on a green card, they have to meet the 5-year residency status in order to get Apple Health. Clients who are undocumented, we'll talk about that a little later on, they are basically very limited into the coverage that they can get. And we'll talk about that a little bit more. Let's talk about Apple Health for adults. Apple Health for adults, you have to be in between the ages of 19 and 64. You have to meet the income requirements, cannot be incarcerated, and you must intend to reside in Washington State. Why is that important? Because we get a lot of people that come to Washington State and perhaps they're a visitor or they're coming to visit their family. And then they get sick or something happens and they want to apply for Apple Health. Well, the law says you have to intend to reside in Washington State. In order to get Apple Health for adults, which is Medicaid, which is free, you apply at healthplanfinder.org. Another program under Apple Health is Apple Health Pregnancy Medical. So this is for a woman, regardless of her immigration status. If she intends to live in Washington State and she meets the income guidelines and she's pregnant, she could be eligible for pregnancy medical. When a woman is on pregnancy medical, she's going to get all of her delivery coverage plus 2 months of full coverage, what we call postpartum coverage, and then she'll get 10 months of family planning. She can apply for that at WashingtonHealthPlanFinder.org. So a woman that's undocumented and she's pregnant, as long as she meets income guideline, intends to reside in Washington, she should be eligible for Apple Health Pregnancy Medical. We have Apple Health for children. Apple Health for children are for children through age 18. Again, they must intend to reside in Washington State. They have to meet income guidelines. They apply at WashingtonHealthPlanFinder.org. kids, if we have kids who are living on their own, if they're homeless, they can also apply on their own to get Apple Health. And so in those cases, we have them work directly with the navigator, because when someone is under the age of 18, the system won't allow them to submit their own application. But if you are working with homeless teens, they are eligible for Apple Health on their own. We just we'll partner them with the navigator so they can get their coverage. Now let's look at some income guidelines, so this will make more sense to you guys when we talk about Apple Health. So for Apple Health for adults, if you look in our second category there, the second line down, this is 138% Apple Health adults, 19 to 64. Those are our income guidelines. So for one individual, their income can go up to $1,468, and they're eligible for Apple Health. If it's a family size of 2, then as you can see in the next column over, their income can go up to $1,983, and they're still eligible for Apple Health for adults. And if you go down to the next line, 198% Apple Health pregnancy medical. When a woman is pregnant, her unborn baby counts in the family size. So for a pregnant woman, we would immediately go to, if it's just her and her unborn baby, she'd be considered a family size of 2. Under the family size of 2, her income can go up to $2,845, and she would be eligible for pregnancy medical. A lot of times we see women who are pregnant and they're working and they have some type of employer-sponsored insurance. That's totally fine. If they meet income criteria, we can still get them enrolled in pregnancy medical. So their insurance with their employer would be primary, which would mean the state would bill them first. Then anything additional, so if there's a deductible, if there are co-pays, if it's co-insurance, whatever that may be, then her Apple Health Medicaid would then provide coverage for any additional balance that she has. Now, I want you to go down to where it says 200% is for basic food. Go down to the next level, which says 215% Apple Health for kids. This is one of our first kids program. We have 3 kids program in our state. We're pretty fortunate to have that. The first program, it says it's free. So that means that there is no monthly premium. This is one of the few programs under Apple Health that you'll see a premium. However, in this category, and let's look at a family size of 3. So if we look at a family size of 3, the gross income for a family size of 3 can go up to $3,892. So if a mom's, dad's income falls in that category, their coverage is free. But let's say their coverage is slightly over that amount. So in that case, we're going to stay on the income chart. And now what we're going to do is we're going to go down 3 columns, three rows, and we're going to go down to where it says 265% Apple Health for kids with premium. That's your first program that has premiums. So what this says is, let's look again at a family size of 3. For a family size of 3, their income can go up to $4,797. The difference is they now have to pay $20 per child per month with a maximum of $40 that they would have to pay. And then the third category for kids, if you go down 2 more rows, is 317% Apple Health for kids with premiums. So again, let's look at the family size of 3. For a family size of 3, the income can go up to $5,738. The difference here is they pay $30 per child per month with a maximum of $60 per month. What's really nice about the kids program, whether they're paying for free coverage or they're going to be paying a $20 premium or a $30 premium, the coverage is all the same. The difference is just the premium. Of all of our programs we have in Washington State, our children's medical program has the highest income levels. And so in our state, in our county, we have about 1% uninsured rate for kids. And a lot of that is because our insurance that we have for kids, because the income levels are so high, it really affords the opportunity to allow kids to be covered. Kids are covered for medical, dental, vision, prescription, x-rays, they are covered. embraces if it's medically necessary. So once someone is approved for Apple Health, then they have to, most clients, not all, most clients have to enroll in what we call a Healthy Options Plan. And what that does is it's managed care. And what managed care basically says, we need for your clients to enroll in a plan. Once they enroll in a plan, they choose a provider. In King County, we have 5 different health plans. We have a mayor group, we have community health plan, we have coordinated care, we have Molina, United Healthcare Community Plan. Now, the nice things about these plans is, one, at the time of enrollment, when someone's approved, they're immediately, if they are eligible to enroll in a plan, are enrolled into a health plan immediately. So that's why it's really important when we're working with clients, we want to know who is their medical provider, because we want to make sure whoever they're seeing currently is in one of these plans. If for some reason they get enrolled in the wrong plan, we can enroll them the following month into the correct plan. So they're not locked in for an entire year into one of these health plans. They can change every month. Now, I said earlier that not everyone gets enrolled into a health plan. Health plan, if a client is undocumented, they are not enrolled in a health plan. It's only clients who are US citizens or they're here legally, then they are enrolled into, or a refugee or asylee, they are enrolled into a health plan. So what's covered? Well, when someone is on an Apple Health program, they get medical, they get dental. For an adult, though, the dental is limited, but they do get coverage for dental. They get vision. However, for an adult, they only get coverage for the eye exam only. For children, they're going to get coverage for the vision screening plus their hardware. There's hospitalizations, there's laboratories, there's x-ray, there's mental health and drug and alcohol, there's COVID testing and screening, and much more. So the coverage that's under the Apple Health programs are very generous, both for children and both for adults. But the question really is as we said earlier, Apple Health is based on your income. It's based on citizenship, it's based on income. If you're eligible for Apple Health, you're gonna have very generous coverage. But what happens if you're over income for Apple Health? Are there any options? Yes, there are. So when healthcare reform rolled out in 2013, one of the things that our state did is they said that we are gonna create a marketplace for you to go shopping. That's why you get enrolled. When I say you go to the website, Washington Health Plan Finder, that's our marketplace where you can shop. And when you go to that website and you enter your information, you set up your account, if you're eligible for Apple Health, you get enrolled immediately. If you're over income for Apple Health, or you can't enroll into Apple Health because you're here on a green card and you've been here less than 5 years and you can't get Apple Health, you should be eligible to enroll into a qualified health plan. Qualified health plans are private insurance plans that are approved by our insurance commissioner in Washington State. Now, if someone is currently on Apple Health and they go over income, they can enroll anytime into a qualified health plan, because that's called a life-changing event. You had insurance and you lost your insurance, and now you have to enroll in a plan. However, for most folks, if they don't have any insurance right now and they want to enroll in a plan, they have to wait until what we call open enrollment. Now, open enrollment occurred from November of last year until the end of December. However, because of the coronavirus, our state exchange, who's the one that managed the qualified health plans, has opened up a special enrollment period. Under that special enrollment period right now, anyone that does not have health insurance or they chose not to enroll, they have until May 8th to get insurance. So if someone's on Apple Health, they're fine. If someone decided that they no longer wanted Apple, they were over income for Apple Health, and during open enrollment, they looked at the premiums and they said the premiums were too much and they didn't enroll, this is a great opportunity now, up until May 8th, to try to get insurance. Because if they don't do it before May 8th, the next time they can enroll into a qualified health plan won't be until November 1st. Now, when you go from Apple Health, which is basically free, to a qualified health plan, things change. And what I mean by that is now you're going into the private insurance market. So now you're going to look at how do you pay monthly premiums? How do you pay your co-payments? You're going to have co-insurance. So those things then change how you look at insurance, because now you're spending more money in order to have coverage. The one really great thing about a qualified health plan is, depending on a client's income, they could be eligible for a premium tax credit. And what a premium tax credit says is that based on your income, we are going to allow you a certain amount of money for you to help pay your insurance every single month. Now, in order to get a premium tax credit, 1, you have to meet the income guidelines. 2, you have to file your tax every year. And 3, you can't be enrolled in employer-sponsored insurance or on Medicare, and you can get a tax credit. And we talked about this a few minutes ago. We talked about the fact that the state has opened up a special enrollment period for individuals that do not have health insurance. If you have clients or you're working with individuals who do not have health insurance, we really want to encourage them to enroll. And it's for individuals that are currently uninsured. So right now, someone is within the qualified health plan. What they can't do is they can't say, I want to change my health plan and use this opportunity to change their health plan. No, they can't do that. But this would be for individuals who have no health insurance. They have until May 8th to enroll and try to get coverage. What are the costs in the qualified health plan? We talked about that. We talked about the fact that under Apple Health is free. When you go into a QHP, a qualified health plan, it's no longer free. You have to share the cost, the monthly premiums, the co-pays, the co-insurance. Under the Affordable Care Act, when it rolled out in 2013, we got help under what's called the tax credit. And with the tax credit, remember, based on your premium, a certain amount based on your income is going to be allocated every single month for your premium. So for example, let's say that you input an application for you through Health Plan Finder, you're over income for Apple Health. Then it says that you're eligible for a qualified health plan with a tax credit of $250 per month. And as we're looking at your premiums, we see that your premiums, the premium that you chose is $300. What happens is that $250 is deducted from that $300. That means that all you pay every single month is $50 for your insurance. There's also, under the Affordable Care Act, there is a provision that's called cost reductions. We're going to reduce your out-of-pocket costs. So what are the out-of-pocket costs? Well, for example, you have co-pays. So every time you go into your doctor's office, they ask for your insurance card and your ID, and they say, you have a $20 copay. Well, if you're eligible for cost sharing reductions, that's going to reduce that $20. It can reduce it to as low as $1, or in some cases, they don't even have a copay. You have co-insurance. What's co-insurance? Co-insurance is when that bill goes to your doctor's office, your insurance company may pay 80% of it and you pay 20% of it. However, if you're eligible for the cost sharing reductions, that's going to reduce how much you have to pay. You have a deductible. You have an annual deductible. Annual deductible is just like if you have a vehicle that you're driving and you have a car accident, you have a deductible. It's the same thing with insurance. When you have to buy a private plan, you have a deductible. So let's say your deductible is $250. If you're eligible for cost sharing reductions, that's going to reduce your deductible. In order to get cost sharing reductions, you have to choose what's called a silver plan. So health insurance can be very complicated, but under the Affordable Care Act, the insurance is gathered into plans. You can buy a gold plan, you can buy a silver plan, or you can buy a bronze plan. What a gold plan basically says is that the insurance company is going to pay 80% of the bill, you're going to pay 20%. Under a silver plan, if you choose a silver plan, that's where you get your cost sharing reductions in a silver plan. So there's two things you do when you have to buy a plan that's going to reduce your amount that you have to pay. One, you have monthly tax credit that's going to reduce how much you have to pay every single month out of your pocket. And two, you're going to have cost sharing reductions, and those cost sharing reduction is going to reduce the additional things you have to pay. Okay. So you know what's covered. Now under Apple Health, we talked about under Apple Health, it's very generous, the coverage. You get medical, dental, vision, prescription, x-rays, all that's covered. When you go into a qualified health plan, the coverage is a little different. It's not as generous, but what you get is you get doctor visits, you get hospitalization, you get maternity care, you get pediatric care, newborn care, you get prescription drugs. All your preventative screenings are free. So that means that if a client needs to get a flu shot, it's free. If they need to get a mammogram, a colonoscopy, there are no co-pays. There's no deductibles for that. Those are all free because they are preventative. If someone needs a screening for depression, it's covered. It's a screening. So therefore, those would be free. And you also get coverage if you do have asthma. It's going to be covered. Mental health, drug and alcohol is all covered. And because of the coronavirus, for testing and screening for COVID-19, there are no co-pays, there are no co-insurance. You get all of that for free also. So when you're thinking about insurance, especially if you were working before, so let's say that you were working and you lost your insurance. The one thing you want to consider is, do I want to buy Cobra or do I want to go into the exchange and try to see what options are available for me? Before you purchase Cobra, you want to always go into Washington Health Plan Finder and figure out what you're eligible for. Are you eligible for Apple Health, or are you going to be eligible to buy a qualified health plan? And if you do buy a qualified health plan, how much is your tax credit going to be? Once you determine that, then you can look, if you do have an employer and they've offered you Cobra coverage, then look at the cost of Cobra. And then you make your comparison. Is it better for you to enroll into Apple Health, or is it better for you to enroll into a qualified health plan? Or is the insurance plan that you had at your job so spectacular and you can only get in on a Cobra? Do you want to do that? But those are your options. That's what you want to look at to make the best choice when it comes to insurance. Now, before I move on, it looks like there's a couple questions, so let me see if I can take a look at these questions. Can someone enroll by May 8th in a qualified health plan if they previously had employer insurance but became unemployed due to COVID-19? Yes, they can. So you can be enrolled because you previously had employer-sponsored insurance. You no longer have it, and since you no longer have it, then since you no longer have that insurance, yes, you can enroll into a qualified health plan. And the second question is, did you take into account public charge for immigrants and refugee population for health insurance information provided? So public charge basically says it's for individuals who are seeking a green card. Individuals that are getting insurance under a qualified health plan, if they have a green card already, this doesn't apply to them. Public charge only applies to individuals who are seeking a green card. A client who is undocumented is undocumented, and at this point there isn't any laws out there saying that someone who's undocumented is going to be able to get a green card. A client who is undocumented will be eligible for pregnancy medical. Their kids will be eligible for children's medical. They will also be eligible for alien emergency medical. So remember, public charge is for individuals who are attempting to get a green card, or if they leave the country more than 6 months and they have to reapply for a change of status. A client that already has a green card, public charge doesn't apply. A U.S. citizen, public charge doesn't apply to them at all. It's only for individuals who are seeking to get a green card. If they are undocumented, they're going to be eligible for pregnancy medical as long as they intend to reside in Washington and as long as they meet income guidelines. They would be eligible for also what's called alien emergency medical. Alien emergency medical are for individuals who have an emergent health condition and they do not meet the criteria to enroll into Apple Health. That means client who's undocumented can enroll in Apple Health. A client who's here on a green card, but they've only been here less than 5 years, are not eligible for Apple Health. Then they have an emergent health condition, something that puts them in the hospital. They could be eligible for alien emergency medical. So AEM is what we call it. It's going to be for any hospital admission if someone has a cancer diagnosis. If someone needs COVID testing and screening, that's also covered under AEM. For children under 19, they haven't reached their 19th birthday. With the Children's Medical Program, remember, immigration status is not a factor. We have 3 different programs for children. So if a child is undocumented, in most cases, the family's income should meet, in most, not all, and we should be able to get the kids enrolled in Apple Health for Kids. The Coastal Islander Healthcare Program. The Coastal Islander Healthcare Program is a program that rolled out almost 2 years ago, and it's mainly for individuals who are from the Coastal Islands. So that would include the Republic Island of the Marshall Islands, Micronesia, Republic of Palua. Those individuals, if they meet income guideline, they can enroll into a qualified health plan, and the healthcare authority pays all their premiums and all their co-pays. So the eligibility for that is they have to meet income criteria. They have to be residents of Washington. They have to not have insurance through their employer where they already have the coverage. And if they meet those criteria, then we get them enrolled into the Coastal Islander Healthcare Program. They choose a silver plan, so they choose the plan that they want. The state pays their monthly premiums, and then they get a card that pays for all their co-pays and co-insurance. So they pay nothing. And really soon here, Coastal Islanders will also have the ability to get a dental plan. So if you know clients who are from the Coastal Islanders, they can enroll anytime. So if they do not have health insurance and they are eligible for Coastal Islander, they do not have an open enrollment period, we can enroll them anytime. I just want to remind folks that although right now, because of COVID-19, that there isn't, you can ride the buses for free. That won't always be. The buses will eventually, transportation will eventually start costing individuals to ride it. We always include this because there's a huge correlation between getting medical and not being able to access transportation. When a client is on Apple Health, they're automatically eligible for the ORCA Lift program. And so we want to make sure that we educate folks about the fact that they can get on ORCA Lift. In July, we're going to be rolling out a new program that's going to be called the Low Income Program, where it's actually going to provide clients on ORCA Lift with a free card if they meet certain program eligibility. So again, those programs are really important. If someone's eligible for Apple Health, we always want to give them on ORCA Lift, because we want to make sure that they're able to access their medical appointments. The Breast Cervical Colon Health Program. This is another really good program, especially for clients who are undocumented. When a client is undocumented, we know that we can get them alien emergency medical. We know that we can get them pregnancy medical. We also know that the kids are eligible, that we can get the kids on medical. But if that woman needs a mammogram, she can also be eligible for a free mammogram. If during that mammogram, if we see something that's suspicious and we have to do an X-ray or MRI, that's also covered. And in the unfortunate case, if she is diagnosed with breast cancer, she would be enrolled into the breast cancer program. And under that program, she would be able to get her surgery, reconstruction is all going to be covered. So we really want undocumented women. If a person is undocumented, it's really important that they understand that there are healthcare options available for them in Washington State. And then we have the Basic Food Program. And I'm sure most of you are familiar with the basic food program, but one thing I do want to point out is that if you do have families who are undocumented, even though they may not be eligible for basic food, their U.S. citizen kids may be eligible for basic food. Now, public charge says that when they look at a basic food program, public charge only looks at the person who's getting the benefits for. So under basic food, the basic food benefits aren't for the undocumented woman or for that individual trying to get a green card. That basic food is for the kids. It's for the U.S. citizen kids. So there is never a public charge. So I wanted to bring those out because there's been a lot of different misconceptions about that. Because when we're working with clients, the one thing we want to do is they may come to us for Apple Health because they need insurance, but we're looking at every single program that they potentially could be eligible for. Not having insurance, need a medical provider. This is our flyer for our Community Health Access Program. In King County Public Health, we are the lead navigating organization for health insurance in our state. So I manage that program. Under that program, we have 300 navigators. Within my team, I have what's called enhanced users. Those enhanced users are trained just like the call center, where they can clear errors, where they can deal with technical issues. So if clients need help, they can call us and we're able to help them over the phone to get enrolled into insurance. If you are a navigator and you have an error or you have an issue or you can't figure out why a client's not being approved, you can contact us and one of our enhanced navigators will be able to help you and figure out the issue on your particular case. We have on the team, we have staff that's navigators that speak various languages, and the languages that are not available, we will also contact our language line and get help over the phone so we can help the client in their native language.
Thank you so much, everyone, for joining us today.